Hi, my name is Lisa. I'm with Xcellerated Nurse Aide Training, and I'm going to show you the skill perineal care. Let's get started. I'm going to wash hands.
Come in.
Hi, Mrs. Smith. My name is Lisa, and I'm going to be your CNA for the day. The nurses asked me to come and do some perineal care. Is that all right with you?
Yes.
All right. Before I get started, I want to make sure we have some safety checks in place. Your call bell is here on your right side. Your bed is in the lowest lock position, and I'm going to provide you some privacy. You doing okay today? Any problems, pains that I need to let the nurse know?
No, ma'am.
All right. Is the temperature in the room okay?
Yeah.
All right. Well, let me step out and I'm going to grab my supplies.
Okay.
Thank you, ma'am. I'm going to wash hands. I have my barrier. I'm going to place it on my table. I'm going to do it nice and neat. No flippy floppies. Okay. I'm going to place it over here within reach because you don't want your table too far away when you're taking care of a resident. Okay? I'm going to grab my other supplies. I'll be right back. Okay. I'm going to gather my supplies out of my three-chest drawer. I'm going to grab our water basin with some soap. Alright, so I have a plastic barrier to protect the sheets. I have 4 wash rags. I have another towel, and I have a pair of gloves. And then I have my bath sheet that'll keep her warm and maintain her privacy. Alright, Miss Smith, I'm going to go ahead and put my gloves on. We're going to place this barrier on top of you. Is that all right?
Yes.
All right. This is going to keep you nice and warm and maintain your privacy. You can put this top bath sheet on without gloves, but if you may forget to put them on before you go underneath the resident, just put them on the beginning.
That's warm.
Oh, good. I'm glad to hear that. All right. Ms. Smith, if you don't mind holding this top sheet, may I remove the bottom?
Yeah.
Okay. You want to make sure you're low, but not like this, exposing. Because anybody sitting on the side over here could see everything. You're going to bring it past her knees, or just to her knees, because you want to get to the area that you need to clean, which is the perineum. Okay. I think I got it far enough. Yes. All right, Mrs. Smith. I'm going to need to put this barrier up underneath you. May I place it on top of you so I can visualize where it needs to go?
Yeah.
This is just a disposable pad so to keep your sheets nice and warm and dry. I'm going to roll it towards me. I'm going to do it halfway. I'm going to tuck it right here. You can place it down here or even on your barrier if you want to. Okay. So I'm going to place it like that. Alright, so I'm going to have you scooch towards me, and then we're going to turn over. You want to scoot any resident towards you and then turn them into the middle, because if you turn them at this point, they're going to be too close to the edge. Alright, so let's go. On the count of 3, we're going to go 1, 2, 3, scoot towards me. Alright, I'm going to take her leg like so. I'm just showing you, exposing it. Cover it back up. Okay. I'm going to make sure her arm is out of the way because I wouldn't want her to lay onto it. All right. And so we're going to go over on the count of 3. Ready? 1, 2, 3. All right. And then we're going to place the pad up under the resident. And you want to be sure you have enough pad down here to keep the sheets underneath dry. Okay? They will check to see if your sheets are wet or dry. All right, come back on 3. 1, 2, 3. All right, and we're going to go back to the center. 1, 2, 3. Good job. I'm going to go on the other side. I'm going to reposition and make sure that pad is in place. All right, let's scooch towards me. 1, 2, 3. Same thing as before, leg over, arm, 1, 2, 3. You want to make sure the gown is not up underneath them either. Okay, 1, 2, 3. Back to the center. Now, a real person would be a lot easier to move them around, but Mrs. Smith is my dummy. Okay. All right. Let me go ahead and get some other stuff and get it ready. What you want to do is you want to make sure your resident is fully prepared for the water because you don't want the water to get cold. All right, Miss Smith, I'm going to place this towel down here. Is it all right?
Yeah.
All right. And this is not necessary. If you forget to do this step, it's okay. It's just trying to get them in the most prepared way. So I'm putting that towel this way. Okay. So when I roll up her gown, I'll have the towel covering her body. All right. So now I still have my 4 wash rags, my soap, and my basin, and I'm gonna go grab some water. I'll be right back. All right. So I'm gonna go ahead and get my water. I'm gonna take a towel. I'm gonna turn the water on. And we're gonna get it nice and warm. You just start this towel. Fill it up halfway. New towel to turn your water off. And you can check it with your wrist or your elbow. Okay. All right, Mrs. Smith, I have your water here. I have checked it, but I would like for you to check it and make sure the temperature is comfortable for you.
Okay.
All right, we'll go ahead and put your hand in there. How's that feel?
Well, that's good.
All right, good. We're going to immediately put our wash rags into your water basin, all 4 of them. All right, Miss Smith, I'm going to go ahead and pull this blanket up. You tell me if you get cold, okay?
Okay.
All right. So I'm rolling inward, and I'm pulling the towel this way. When I'm rolling inward, I'm gathering that gown, so you don't want any of the gown to get wet. And I'm pulling that towel at the same time. You only expose the area that you need to expose. Okay, cover this up. Minimally, as much as possible. Okay. All right, you okay? The temperature's still okay in the room?
Yeah.
All right, I'm gonna go ahead and get started. So I'm gonna get my first wash rag and I'm going to wring it out, and we're going to use what they call the 4 corners. I hold it in my hand like this, and the open areas is where you're gonna clean. So I have a small hand, so I have to fold my hand like this. This is gonna be the first one, second, third, fourth, and then I take those parts I just cleaned, all the open areas here. I'm gonna put it in my hand. I put the dirties in my hand, turn it this way. It's gonna be 5 and 6, okay? And I'll show you. So this first rag, I'm gonna put soap on. All right, so I got some lather and bubbles. The state would like to see plenty of lather and soap, okay? All right, so I'm gonna go ahead and I'm going to clean my resident. Mrs. Smith, may I place my hand on your abdomen? Always ask them if you can touch them, okay? May I place my hand?
Yeah.
All right, so I'm gonna put my hand here, and with the first corner, I'm gonna go down the vagina, just kind of on the outside. So you just go 1 swipe, that's 1. I never generally take my hand off, so I'll turn my rag this way and hold it with my thumb. So my second one is going to be the labia furthest from me. So I'm going to do the left labia. If you're on the other side, it would be the one furthest away from you. So that's the second one. I'm going to flip it, and then I'm going to do the third one. So I'm going to do the right labia, and then I'm going to flip it one more time, and then I'm going to open up the vagina and go down. All right, so now I'm going to take the dirty parts that I just cleaned, put it in my hand like that. So all the open areas are pointing towards me, so you don't cross-contaminate. So I'm going to fold it this way, and we're going to do the left groin. May I place my hand on you again?
Yeah.
Here's the left groin. Flip it over, and we're going to do the right groin. That wash rag is complete. I'm going to place it on my bin away from me, like so, and then I'm going to rinse. So what you wash, you rinse. What you rinse, you dry. So we're rinsing right now. Same manner that we just did. Fold it up. May I place my hand on you?
Yeah.
I'm going to go down the center. That's 1. Left labia. 2. Right labia. 3. Open up. 4. Dirty's in my hand. Fold it. May I place my hand on you?
Yeah.
Left growing and right growing. That's rinsed. Now we're going to dry. So you're going to take a part of the towel. Oh, every time you dry somebody, it should be a different part of the towel. So I'm going to grab this point of the towel, and may I place my hand on you?
Yeah.
I'm going to pat dry. Pat, 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 pat. Go down. Anytime you clean a female, it's always down the center, okay? So I remembered this is going to be my one part that I dried, so I'll remember that. All right, Mrs. Smith, I'm going to go ahead and pull your gown down and take this towel down. We're going to go on our back side. We're going to clean your bottom, okay?
Okay.
All right, we're going to unfold. See how when you take that gown out, it gets undone? I take this towel at the same time. Knowing this is the part I dried with. Okay. Cover her back up. Go ahead and have her scoop towards me, and then we'll turn her over. All right, Miss Smith, we're going to come towards me on the count of 3. Ready? 1, 2, 3. We're going to make sure that arm is out of the way. Her leg is crossed, and we're going to go over. All right, on the count of 3. 1, 2, 3. Okay. And you want to only expose the area that you need to expose. So I want her rectum exposed. I'm going to kind of cover her backside too if I can. Trying to get that gown out of the way. So the area that you clean is from the rectum to basically the top of the buttocks. You don't want to clean between the rectum and the vagina because that's called the perineum. It's a perineum area. You've already cleaned it. You don't want to cross-contaminate. So go from rectum up to the top of the cheeks. So I'm going to do the same manner. I'm going to take a rag. I'm going to rinse it out. And I'm going to put soap on it, and we're going to do the 4 corners on this side. But we're only going to use 4, not 6. Soap, not over our basin. Some lather. Just make sure you have a controlled rag. Meaning you don't want a rag like this. You want, clean like that. You want to make sure the rag is folded and controlled. Okay, I'm going to do the 4 corners, and the first one's going to go from the rectum up. The second one's going to be the right buttocks. Third is going to be the left buttocks, and the 4th one's going to go back up from the rectum. Okay, here we go. Making sure we don't cross-contaminate the rectum. I kind of put my finger like this to hold the rag just to make sure. I'm going to place my hand on you, ma'am. Is that okay?
Yeah.
All right, so we're going to go from rectum up the buttocks. I'm going to flip that one. May I place my hand on you?
Yeah.
All right, we're going to do the right buttocks, and it's just a swipe. That's 1. May I place my hand on you?
Yeah.
And this is the left buttocks. And then we're going to, may I place my hand on you?
Yeah.
I try to keep my hand on her just so we don't have to ask her so many times. But all right, so now we're going to go back up the rectum. I'm going to control that rag and go rectum up. That's washed. So what you wash, you rinse. What you rinse, you dry. I'm going to rinse out that rag. Same. All right, so here goes the first one. We're gonna, may I place your hand on you?
Yeah.
Rectum up. We're gonna do right buttocks, left buttocks, and now rectum again. See, I didn't take my hand off her, and I had to ask her so many times. You doing all right, ma'am? Is it still warm?
Yeah.
Not cold or nothing? Good. All right, and I'm going to take that towel, And I'm just going to pat dry. Pat, 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 pat. All right, and that's that. Now you have your resident on their side. You're gonna go ahead and get that barrier that's up underneath there, because that's the number one thing that's forgotten in this skill is that barrier. So go ahead and get that barrier. We're gonna roll it. And we're gonna tuck it up underneath there, okay? I'm gonna take this towel and I'm gonna roll it away from me and I'm gonna place it on my barrier. I never leave my resident on her side when I get rid of my linen. So, all right, Mrs. Smith, we're gonna roll back on the count of 3. 1, 2, 3, and back to the center of the bed. Okay. Make sure she's covered. Okay. Go and get the barrier on the other side. It's the number one thing that gets forgotten. All right. So, Mrs. Smith, I'm gonna have you scooch towards me on the count of 3. 1, 2, 3. See where that barrier is. I'm gonna have you roll over, make sure your arm's okay, your leg, 1, 2, 3. And that barrier is right there, so I'm gonna go and roll it away from me. There we go, back. Okay, I'm gonna toss this in the trash. I'm gonna go ahead and get my linens. Roll this in a nice little ball. Miss Smith, I'm gonna go ahead and get rid of my water. Are you still okay, warm?
Yeah.
All right, I'll be right back. Thank you. All right, so I'm gonna get rid of my water. I'm gonna dump it in the sink. Then I'm gonna place it in the sink. I'm gonna get a towel. I'm gonna get that towel to hold the barrier. I'll never let go of this towel till I throw it away and take my gloves off. I'm gonna take this towel, I'm going to open up the water, discard, we're going to rinse, dump, rinse, dump, rinse, dump. I'm going to get a new towel, turn the water off, discard, get another towel, I'm going to clean the inside of my barrier or my basin. And if it's not dry, you can get a second towel, but mine's okay. And I'm gonna do my outside with another towel. All right, and now I wanna get another towel. This is gonna open my drawer and it's gonna grab my supplies. I'm gonna grab my towel, I'm gonna grab my soap. I'm gonna place it in my drawer, or my basin, and I'm gonna place it in the drawer. With the new towel, I'm going to open that drawer. I'm going to place my basin in there and shut it. So here we go. This towel, I haven't let go yet. This one will go in the trash. This is a clean one. I'm going to close it. Now my gloves come off, like a C. Roll it in a ball. Scoop. Roll it in a ball. Gloves come off, what do? Wash hands. Okay. All right, Miss Smith, I'm gonna go ahead and get rid of that barrier that's on top of you. You doing okay? Any pain, distress?
No.
No? All right, so let's go ahead and remove this. And you can roll it and tuck however you want, but you want to make sure that gown is up underneath, just like I did. If you can't reach over, go on the other side, and so you don't cross-contaminate your uniform like I just did. Now roll this away from her. Doesn't have to be perfect yet. Place that there. Cover it up. Place it in your laundry. Okay? Alright. Mrs. Smith, I'm going to fix your gown. You want to make sure your resident is wrinkle free as possible.
Yeah.
Alright, now make sure your cowbell is within reach. Your bed is in the lowest locked position. Your privacy, would you like to keep the curtain open or shut?
Shut.
Shut, and we'll leave it like that. Here's your table. Alright. You want to make sure your resident is presentable. Like I said, wrinkle-free as possible. Alright. So I think I'm all done. Want to make sure the number one thing that's forgotten on this skill is that peri pad. That pad, this bubble pad that goes up underneath. And I did check to make sure that it was not wet. Always make sure your bed is not wet or your gown is not wet, because if it is wet, you'll need to change it. Okay? All right, I am finished, and so I'm gonna double check myself. I'm gonna say wash hands, skill complete.